The definition of primary health care is a very important definition and should be remembered all the time. Primary health care has been defined as essential health care made universally accessible to individuals and acceptable to them through their full participation and at a cost that the community and country can afford. The remaining lecture will clarify these points. The term primary health care came into existence in 1978 following AMA-ATA conference. They said that primary health care is equally valid for all the countries, developing or developed, rich or poor, though it can take varying forms in each country depending upon its culture, education and socio-economic conditions. It was accepted at that time that primary health care is the key to attain health for all by 2000 AD. Elements of primary health care. Generally, the society thinks that health care is synonymous with medical care. Actually, medical care affects health only partly, and it includes medical education, medical research, etc., so many things. But medical care comes into play only when health deteriorates and illness sets in. So it affects only a part of health. Optimum health is determined by other sectors too, like nutrition, provision of safe drinking water, provision of sanitary disposal of excreta, immunization, etc. The list of these facilities or services is very long. Hence, a basic minimum package of services from different sectors which affect health and help in eliminating the factors contributing to ill health have been selected to be included as a part of primary health care. So when these all services are being provided, we say that primary health care is being provided. These services are been called as elements of primary health care. A list has been provided of factors which affect health in a good way: adequate food, safe drinking water, proper sanitation, clean environment, healthy living lifestyle, access to good health services, education, etc. And the other list is of factors which cause ill health. So what are the elements included in primary health care? These are education concerning the prevailing health problems and the methods of preventing and controlling them. Education of the local population, that what are the health problems that are prevalent in their population and how can they safeguard themselves against it, and what they are supposed to do if they contract the illness. So educating people regarding the prevailing health problems. Promotion of food supply and proper nutrition, that is availability of enough healthy food. Adequate supply of safe water. Water should be safe and adequate in amount, and basic sanitation. Fourth, paternal and child health care, including family planning, immunization, prevention and control of locally endemic diseases. Point 1 included educating the local population regarding the locally endemic diseases. Point 6 is the measures taken by the administration for prevention and control of local endemic diseases. Appropriate treatment of common diseases and injuries, and provision of essential drugs, that is medical care. Now, principles of primary health care. We just discussed about the elements. What are the services to be delivered to say that full primary care health care is being delivered. The principles of primary health care are equitable distribution, community participation, intersectoral coordination, and appropriate technology. We shall clarify these principles in the following slides. The first principle is equitable distribution. What does that mean? It means universal access to health services irrespective of the ability to pay. The poor or the rich should have equal access to healthcare services. Lack of equitable distribution means that some people do not have even basic minimum medical care, health care, while some population have a concentrated health services. So that is not equitable distribution. Equitable distribution means investing more resources in the areas where it is needed more. So higher priority should be given to high-risk groups, which include women, children, underprivileged segments, and areas which are underserved. It means that the governments should undertake activities to identify those who are at high risk and to provide continuum of care to them and eliminate factors that are contributing to ill health among them. Continuum of care means from primary care level to secondary care level and referral to tertiary care level if required should be smooth and effective. Equitable distribution is the key to attain health for all. What is the situation at present? There are gross inequalities in healthcare services provision among countries and even within countries. In India, the health services are mainly concentrated in the urban areas. And even in urban areas, the slums do not have access to health services. So this results in inequality of healthcare in rural areas and in urban slums. The primary healthcare aims to bridge this gap and shift the center of gravity of the healthcare from cities to rural areas and urban slums and to bring these healthcare services as near as possible to the homes of these people. Next principle is community participation. What does this mean? Community participation is the process in which the individuals and families assume the responsibility of their own health and of the community, that is placing people's health in people's hands. Community participation in healthcare provision ensures self-reliance and sustainability. The people, individuals, they come to know about the health problems of their community and they learn the ways and means of overcoming these. So they are no longer mere passive beneficiaries to what government gives them. They now know what are their problems and what they need. They can even demand supplies and services from the administration for health work. Overcoming cultural barriers to healthcare. So sometimes the conventional solutions to health problems may not be acceptable to the local population because of some cultural restrictions. So if the solutions are in conflict with the local customs, the local people who are involved in the provision of this healthcare can improvise and innovate to make the solutions suitable to the local culture. Of course, they need to be trained to have this capability and they have to consult the technical persons for the validity of the improvisation. So it is the responsibility of the health system to explain and provide clear information about the both favorable and adverse consequences of such modifications. Third benefit would be better communication with the community. Health education can penetrate better because the people who are providing health care and are from the same community, they will talk in the same language which the local community would understand. And also the specific concerns of the community can be conveyed to the official health system who can then take action and become and attain favor of the local community. Fourth, the community can even provide labor and sometimes even financial resources for healthcare provision if required, if the healthcare providers have support of local community. The WHO says that the most realistic method of attaining community participation is to employ community health workers. These workers would provide the first level of contact between individuals of the community and the healthcare system. They can be trained in short time to perform some specific tasks. And they come from and are chosen by the community which they are going to serve. The training and retraining of these workers is a responsibility of administration. And it should be seen that if more complicated care is required or advice regarding a complex problem is required, these community health workers should have someone to turn to for help, someone who is more technically qualified. Examples of community participation in India: village health guides, ASHA worker, Anganwadi worker, trained dyes, village committees. The immediate technically trained worker who will provide technical help to these people is auxiliary nurse midwife. Third principle of primary healthcare is intersectoral coordination. What does this mean? Now, we have already discussed that medical care forms only one part of healthcare. It comes into play when the health deteriorates and disease develops. Primary healthcare is concerned with health promotion, that is better health, disease prevention, and then management of disease if it occurs. For achieving this, we require input from sectors other than health sector. We have already discussed this. Some examples are being explained. Like good nutrition status is associated with lower morbidity, and nutrition status can be improved through development in agriculture and home economics. Education sector, women education and empowerment can improve their knowledge about improving nutrition within available resources. Plentiful availability of potable water can reduce morbidity and mortality, particularly among infants and children. Similarly, safe disposal of waste and excreta has a positive effect on health. Housing that is adapted to local climatic conditions has a positive effect on health. Road connectivity of remote villages is of paramount importance in healthcare because it will improve economic conditions by providing easy access to market and hence more money and thereby more purchasing capacity of food and nutrition. Will enable health, sanitation and education teams to reach the rural areas. Transportation of patients to and from the referral centers would be facilitated. Supply of drugs and biologicals to the health facilities working in peripheries can be regular. The media sector will improve health education, reach the needy. That is, for example, how to prevent mosquito-borne diseases, how to prevent fly breeding, importance of immunization, etc. And also disaster warnings and instructions to safeguard the health during disaster will minimize the loss of health during a disaster. The legal sector can bring about legislations which have a bearing on health. Industrialization will provide jobs and hence more money and better nutrition. It may have some adverse effects also like pollution. So many sectors affect health in one way or another. So this does not mean that the health team which is posted at the primary health center would have the necessary knowledge and equipment for these. That is, the PHC doctor would not go and construct roads or provide safe water or sanitation, but they can educate people about them and they can educate people to demand these from the administration or develop these themselves. The national development planning which is taking place should be done by a multidisciplinary team including health administration. Also at the local level, if one sector is deficient and causing ill health, then for improving the health situation, we need to develop that deficient sector, and this can be achieved if only there is coordination between the health sector and the concerned sector. The fourth principle or pillar of primary healthcare is appropriate technology. What is appropriate technology? WHO defines appropriate technology as methods, procedures, techniques and equipment that are scientifically valid. Number 1. Adapted to local needs wherever possible and acceptable to users and recipients. Maintainable with local resources. Otherwise, if the administration provides hi-fi technology one time, it will be run for some time and then it will not be properly maintained and there is no continuity. It is not sustainable. Appropriate technology in simple words means any technology that makes the most economical use of the country's natural resources, capital and labor and contribute to the national goals. Now in this, wherever machinery or equipment is involved, it should be simple to run and repair and it should be locally produced as far as possible. Some examples of appropriate technology are oral rehydration salt instead of expensive intravenous rehydration in mild and moderate dehydration. Vaccine vial monitor instead of lab testing of potency of vaccines due to possible exposure to heat. Biogas systems in small community rather than piped natural gas or LPG cylinders for clean fuel. For provision of safe drinking water, appropriate technology has been developed like pot chlorination by NIRI. Chlorination with tablets in individual houses. These tablets are very cheap and easily available with the chemists. Chlorinating the wells on alternative days with the help of community workers. Educating the mother to boil water, at least that water which is to be used for babies and children, and small children. Then a first aid kit may be devised using appropriate material like bamboo or wooden sticks for temporary splinting. A simple kit for first aid in snake can consist of string, sterile blade and simple suction devices which are ordinarily used by local healers. Hand centrifuge. This centrifuge was used in 1939 to pack red cells for complement fixation tests and for determining the packed cell volume. Though packing red cells using this device was not easy, but it could be done. In modern times, this can be used during electric breakdowns. Growth charts, they can be easily plotted and maintained by health workers. Vasek apparatus. The apparatus that has been developed to provide an effective, durable, simple and inexpensive instrument for vasectomy. It provides bipolar electrocoagulation of the vas and achieves quick healing of the vas without much trauma. So there is minimum scar tissue and minimum sperm antibody formation. It is quite effective and maintains the probability of surgical reversal. Garlic juice. Fresh garlic juice, it has been shown that it has proven that it has antibacterial properties and can be efficiently used for dressing septic wounds, replacing the chemicals or antibiotics.